Today we will learn the course and the branch of facial artery and its clinical application. This is common carotid artery, and this is internal carotid, this one, and this is the external carotid artery. Common carotid give rise to internal and external carotid. It bifurcate at the level of the thyroid cartilage, upper level of the thyroid cartilage. Then this external carotid artery, this one, it gives rise to anteriorly 3 branches, posteriorly 3 branches, and the terminal, they are terminal 2 branches, that is the maxillary and the superficial temporal. Anteriorly there is superior thyroid, lingual, and the facial, and the posteriorly posterior auricular, and the occipital, medially ascending pharyngeal. So this is the lingual artery. Just above the lingual artery, external carotid at the level of the greater cornu of the hyoid bone. This is the hyoid bone. At the level of the greater cornu of hyoid bone, it gave rise to facial artery. Okay. In the carotid triangle is the triangle of the anterior part of the neck, anterolateral part of the neck, which is bounded by the above by the posterior belly of digastric. This green one, this is posterior belly of digastric, this is anterior belly of digastric, and it is this in the middle there is tendon which is united with this hyoid bone. This is the digastric triangle in between these two, but the posterior belly of digastric, and here is the inferior belly of omohyoid. Omohyoid means omo, shoulder, and the hyoid bone. Here is the omohyoid. Okay, and here is the sternocleidomastoid muscle. From sternum to the mastoid process, sternocleidomastoid. So the superiorly and anteriorly, it is bounded by posterior belly of digastric, anteriorly and inferiorly bounded by the inferior belly of omohyoid, and the posteriorly bounded by sternocleidomastoid. This is the carotid triangle, where this facial artery comes out at the region of neck from the external carotid artery. Okay, this is our facial artery. Now facial artery, it runs deep to the, you can say beneath the posterior belly of digastric and the stylohyoid muscle. Posterior belly of digastric, I have already told that here is the digastric fossa. The anterior belly is attached over there, and there is in between there is a tendon, and then it is going up to the mastoid process. So posterior belly of digastric, and the stylohyoid, from the styloid process of the temporal bone and to the hyoid bone. This is stylohyoid, and stylohyoid is anterior to the posterior belly of digastric. So here we can see that it runs over the, in yellow color this is the stylohyoid, and in green color posterior belly of digastric. It runs beneath, इसके पीछे चलता है, or you can say it runs over. This is the middle constrictor muscle, and this is the superior constrictor. These are the pharyngeal muscle. This facial artery runs over the superior constrictor and the middle constrictor, and beneath the, or deep to the stylohyoid and the posterior belly of digastric, and some part of the submandibular gland. This blue one is the submandibular gland. Okay, then here it is in the, it form a looped course in the submandibular region. Here it is in the submandibular region, and really here is in the carotid triangle, and then submandibular region. Then it come anteriorly, wind over the body of the mandible. This black one, this is the mandible. This is the body of the mandible. This is the ramus of mandible. And this is the conoid process, condyloid process. And this is the masseter muscle. So antero-inferior, this is anterior aspect of the masseter, and inferior. This is antero-inferior angle of the masseter muscle. It just wind around. It comes from posterior to the anterior from below, and then it runs over the ramus of then it runs over the body of mandible, and taking an oblique course, it comes superiorly and medially, making a tortuous course. This tortuous course is very much necessary for the free movement of the mandible as well as the facial musculature. And now it runs along the now it is at the just by the side of the angle of the mouth, and then the lateral part of the nose, and ends up to the medial canthus of the eye. Okay, now we will learn the branches of the facial artery. In the neck region or cervical part, it gives 5 branches, and in the facial region 5 branches. टैग्स सीला, नेक पे टैग हो गया है, फेशियल आर्टरी की बात हो रही है, नेक पे टैग हो गया है, नेक पे एट द रीजन ऑफ नेक, देखिए कितने सारे फोल्डिंग्स आ गए हैं, टैग हो गया है, और ऊपर सीला नहीं है, सीला की जवानी टाइप, तो वो फेशियल आर्टरी मैंने बेमतलब मेकअप कर रही है, जबकि नेक पे टैग हो गया है, तो नेक पे टैग हो गया है, तो टैग्स, so these are the branches at the cervical part, or sela is the branches at the facial part. So what does it mean? Tags: T for tonsillar artery, A for ascending palatine, G for glandular, and S for submandibular gland, submental artery, tags. लेकिन मैंने तो 5 बोला ना, तो 5वां है मास्कुलर आर्टरी. फिर फेस पे कौन सा है? सीला, सुपीरियर लैबियल, इंफीरियर लैबियल, लैटरल नेजल एंड एंगुलर आर्टरी. और फेस पे भी मैंने 5 बोला है, 5वां कौन है? मास्कुलर आर्टरी. ओके, यहाँ पे जो सर्वाइकल पार्ट है, यहाँ पे फेशियल आर्टरी इज़ वेरी मच सुपरफिशियल, जहाँ वो निकलता है कैरोटिड ट्रायंगल में. हर जगह मेकअप की बात हो रही है, फेशियल आर्टरी है तो मेकअप की बात होगी ही. तो एसपीएफ क्रीम है जो सन से प्रोटेक्ट करता है. तो इज जस्ट फेशियल आर्टरी इज जस्ट सुपरफिशियल, इट इज़ ओनली कवर्ड बाय द स्किन, देन प्लेटिज्मा एंड द फासा. एसपीएफ, ओके, जस्ट अ निमोनिक. नाउ व्हाट आर द ब्रांचेस? फर्स्ट इट गिव्स असेंडिंग पैलेटाइन. टैक्स तो याद करना है, लेकिन ए बोला है कि नहीं, ये तो मेरे से लेटर शुरू होता है, तो हम पहले आएंगे. असेंडिंग पैलेटाइन, इट इज़ गिविंग राइज हियर असेंडिंग पैलेटाइन विच इज़ गोइंग टू सप्लाई. Here is the ascending palatine is coming out and going to supply the soft palate and the palatine gland. Soft palate and the gland over the palate, soft palate. Okay. Now the second one, ATG. T से हो गया, फिर टॉन्सिलर आर्टरी. यहाँ द टॉन्सिलर आर्टरी, दिस इज द टॉन्सिलर आर्टरी. इट फर्स्ट pierce the superior constrictor muscle and then supply the palatine tonsil. This is palatine tonsil as well as the root of tongue. This is tongue, and here is the root of tongue. In both palatine tonsil and the root of tongue, it ramify. It gives several branches. It shows ramification over there. Okay. Now third one, ATG, glandular. It supply the, here you can see the submandibular gland. This is the glandular, we supply the submandibular gland. Now fourth one is the submental artery. This is the largest branch of the cervical part. This is the submental. Just when it leaves, here one thing I have mentioned, I've forgotten to mention, that it runs over the groove on the posterior surface of submandibular gland, and then it come out and wind around the lower border of the mandible, or you can say base of the mandible. Just before coming to the base of mandible, the anterior surface of the body of mandible, it gives one branch, last branch of the cervical part, that is the submental artery, which is the longest branch of the cervical part, and it supply the submental region. It anastomoses with the inferior labial artery, which is the branch of the facial artery at the facial part, inferior labial, as well as this is the, in orange color, this is the mental artery. Mental artery is the branch of the inferior alveolar, which is the branch of the maxillary artery. So here it anastomosis occur in between the submental branch of the cervical part of the facial artery, inferior labial branch of the facial part of the facial artery, and the mental branch of the inferior alveolar of the maxillary artery. Okay, now it shows a tortuous course in the face. First it gives inferior labial branch, because it ascends. First what comes? The lower lip. So inferior labial branch. Inferior labial branch anastomose, I have already said, with the mental and the submental, as well as from the inferior labial of the opposite side. This is okay. Now this is the superior labial. Superior labial artery is the more tortuous, having more tortuous course and larger than the inferior labial, and it gives LR branch as well as the septal branch, which supply the nasal septum, and the LR is supplying the L of the nose. Now this is the lateral nasal branch of the facial artery. When it runs just by the side of the nose, it gives lateral nasal branch, which supply the dorsum of the nose as well as the L of nose. Now here it is known as, the terminal part is known as the angular artery, which is going to anastomose with the dorsal nasal branch of the ophthalmic artery. This is the dorsal nasal branch. At the level of the medial canthus, it anastomoses with that. Now coming to the applied anatomy, first it shows a tortuous course in order to give free space for the movement of the mandible as well as the facial musculature. Second thing, this anesthetist used to palpate the facial artery at the level of at the base of border, at the anterior-inferior point of the masseter against the base of the mandible. Okay, and third one, it is going to anastomose here, angular artery anastomosing with the dorsal nasal branch of the ophthalmic artery. So this is the this is the site for the blockage of any of these two artery, that is the ophthalmic artery or the facial artery. Okay, by blocking the dorsal nasal branch, we can block the facial artery, and by, if there is a hemorrhage, we can block this, so that the bleeding will not occur. Okay, and for anesthesia, the anesthetist used to palpate this facial artery at this site. Okay, so this is all about the facial artery. Thank you.